Okay, in this patient who is a left-hand thrower but right-hand dominant for his other activities, he actually has some protraction of his shoulder blade, so he's got some winging of the shoulder blade. The medial board of the scapula is slightly farther out from the midline because he's cheating off his lower trapezius and serratus. So Dr. Kibler taught us the scapular assistance and scapular resistance tests. Let's just have the patient raise his arms up in front. So Ray, go ahead and raise the arms up in front. Do that 2 or 3 times. And he's got a little protraction and not significant dyskinesis, but he still has that winging that is actually type 2 winging here. So just lift this arm up. Go ahead and do that about 2 times. Just to get the patient an idea of what it feels like, and if the patient's having pain when we actually position that shoulder blade back a little bit far back where it's supposed to be. Now go ahead and lift your arm up and do that 2 times and let me know if it feels the same, better, or worse. If the patient tells you that the pain is better and the arm feels better with better motion and better movement tracking all the way up, then that's a positive scapular assistance test. Now the scapular resistance test is actually a test more for strength with shoulder blade positioning. So go ahead and lift the arm up and you'll have the patient lift up and get some idea of what their strength is like in that position. But because he's already in that protracted position, I'm going to bring that shoulder blade back where it's supposed to be, hold that shoulder blade in position, bring the arm up again, and then have the patient lift up again. And generally, well, if that is a positive scapular resistance test, then the patient will notice that he's stronger once that scapula is tipped back like it's supposed to. Some studies show that if that scapula is not retracting back and your person is not using their lower trapezius and their serratus, and that shoulder blade doesn't tip back, that you could lose up to about 20% of your strength, particularly for overhead activities.